Hi guys, so sciatica, obviously a very common issue associated with lower back disorders and injuries. What is sciatica? It just basically means that the sciatic nerve is being irritated or compressed by something. So a few different reasons why that could be happening. Probably the most common, which most people would know about, is having like a disc bulge or a herniation. And obviously disc bulge and herniation, they come out towards the back of the disc and they're going to come out towards where those nerve roots are and start to compress that sciatic nerve root, which is in between those last two vertebrae, lumbar vertebra. So again, if you've got disc bulge or herniations, this could be kind of like an associated complication with that. Generally feels like pain or discomfort or kind of numbness, usually down one leg. And it can go from sort of the buttocks, back of the leg calf, all the way down into towards the toes as well. That's probably the most common cause, but there are other reasons why we could have full-blown sciatica or sciatic-like symptoms. Another way that we can get compression on the actual sciatic nerve is through stenosis. So stenosis just means narrowing of the nerve canal where the nerve sits because you've got like an arthritis-based issue, and that could be pinching on the nerve as well. The other thing we can have is also we can have, just jacked up, funky muscles around your hips all kind of clamped up, and that will give you like a sciatic type feeling, although it's actually more of a muscular issue as opposed to a nerve being like forcibly compressed by something. So obviously what we need to do, like with any back issue, if we've got some sort of pain, we need to investigate that pain and try and understand the mechanics of that injury so we have a clear idea going forward of A, what we need to avoid, but also B, what are going to be our best tools to manage that problem and give it a chance to heal and settle down. So one of the tests that we can run to check to see if it's a disc-based compression of the sciatic nerve is basically just a compressed flexion test. So here I am sat on a bench. I've just got a firm weight plate on top just to make it a bit harder. But all we do, this is how I coach it, is I get people to put their legs together so they can't sort of rely on using their glutes to get their back straight, and then just slump with that lower spine to a horrible kind of position as far as you can get it. Sometimes, just being in that position, you'll feel an increase of sensation at sciatica, which we know definitely then you've got a disc bulge, an active disc bulge or herniation, which is made worse by compressed flexion. So as we need to know going forward, we've got to try and avoid that position as much as possible. So let that disc heal and settle down, and as it does, the sciatica will start to disappear as well. So if we don't get anything in that initial position, we can also grab the bottom of the weight plate or the bottom of the bench or the chair and pull down, add some more compression. And sometimes you need a bit more compression just to kind of sensitize that pain. But again, it just means it's, you need a bit more compression to set it off. So things like, obviously squatting and having flexion at the bottom of a squat is probably going to be not a good thing for you if that's going on and you're sensitive to this test. The other thing we can also do is we can lean to one side to the other as well. So again, compressed flexion, add that compression. What happens if I drop, left shoulder to left hip, back to middle, right shoulder to right hip? Does that make it better or worse one way versus the other? For example, if I lean towards my left, it basically, the sensation gets worse down my right leg. I know my bulge is coming out in that opposite direction. So the bulge is facing out towards the right-hand side of my disc. So again, with some careful testing, we can already start to kind of zero in on the causes of the sciatica and the pain, and then work out where those issues are occurring in everyday life. That's sensitizing everything to pain. So again, for a disc bulge, if we've got sciatica from a disc bulge, doing that compressed flexion test, you'll feel it get worse for sure. There'll be a definite provocation from that test. If you've got stenosis, not so much. That's a little bit different. We run sort of different tests for that. But that'll give you an option as to what's going on. But again, we also need context as well. So what I'll do next is I'll show you a disc recovery position, which if that helps alleviate the symptoms of sciatica, that's another check that you've got, a compressed nerve from a disc bulge or a herniation. Okay, so if we get a positive test to the compressed flexion, i.e. we get a provocation of pain, like it makes it noticeably worse, and we suspect we have a disc bulge or herniation that's compressing that sciatic nerve, we can use the disc recovery position potentially as a way to help alleviate that irritation during the day, but also just a bit more context in terms of double checking that we're on the right track. So with this recovery position, all I do, just start with a very easy one, light bit of extension, just two palms underneath your forehead like this. I'm just going to stay here for sort of 3 minutes or so. And what that should do, if we do have an active disc bulge or herniation, that little bit of extension will just pull that bulge back into the disc, and it should take some of that pressure off that sciatic nerve. If that feels pretty good, we can then also start to progress the position for a few minutes. Maybe do one fist under the chin, and at very most, I probably recommend just 2 fists under your chin. But the whole time, no matter what position you're in, you're trying to let that spine relax towards the floor and take some of that compression out of the discs. So for a lot of people, just this position here, the 2 palms, is going to be plenty for now. But again, if we have a positive result to the compressed flexion test, and then we have in terms of provocation, we get an increase in pain, and then we go into this position for sort of 2-3 minutes and we get a decrease in pain, that's a sign of an active disc bulge, because in this position, as we decompress, it's going to pull that bulge back into the disc and take the pressure off our nerve. Now, if you've got more of a stenosis or arthritis-based issue, this position could actually make you worse. So that's why we can't give the same thing to everybody. We need to investigate the problem at hand before we start giving out recommendations. And it's also entirely possible to have both a disc bulge and a stenosis type issue and also a hip type issue all at the same time. So we just have to work out, when we do these provocation tests, it doesn't just tell us what's going on, it's also going to then guide us as to what we can and can't do, which tools and exercises we can or cannot use going forward. Because what we don't want to do is try and fix one problem and then irritate another existing problem or create another problem as we go. So again, provocation testing and understanding the problem first is absolutely paramount before we start giving exercises. Because again, we don't want to give things with the best intentions and then make the problem worse. So if you get a positive test on the compressed flexion, and then you try the disc recovery position, again, I'll just start with this position first of all. Sort of 3 minutes or so, and you feel a positive result, like it helps alleviate it. Again, that's 2 big ticks that you know, or it indicates that you've got a disc bulge or a herniation that's pushing on that sciatic nerve. One job is to remove causes of flexion, compressed flexion, and give that disc time to settle and heal down, and the sciatica will start to settle as well.